Pip, today I want to ask you about CPAP. What does it stand for and what is it for?
So CPAP literally stands for continuous positive airway pressure. So what we're doing is providing ventilatory support. So we have positive pressure that is continuous, and that means that it's meeting the demands during the inspiration and expiration phase of the breathing. And then we can also determine the PEEP, so that's the positive end expiratory pressure. By doing that, then we're inflating airless alveoli and increasing the size of them as well. So the surface area between the alveoli and the capillaries improves the gas exchange in that select group of patients that require CPAP.
Can you explain to me what PEEP is?
Yeah, sure. So PEEP is positive end expiratory pressure, and that's the residual air pressure in your lungs at the end of expiration. So Chris, if you just breathe out and then breathe out that little bit extra, that exactly is what PEEP is, the residual air inside your lungs at the end of your breathing.
So what is CPAP used for?
Today we're going to talk about the O2 Max, and that's a CPAP device that is used in adults over 30 kilos in the pre-hospital and hospital environment for a specific set of respiratory conditions.
And when would you use it?
We use it as an adjunct for respiratory support for a specific number of conditions. So we use it for congestive heart failure and pulmonary edema, and also to increase the oxygen uptake and decrease the work of breathing and conditions such as asthma, atelectasis, post-operative undiagnosed sleep apnea and drownings. It buys us time so that we can also include other therapies such as drug therapies that are indicated for those conditions, and it decreases the incidence of having to intubate and ventilate patients who fall within that group.
So how does the O2 Max differ from the CPAP machines used in the hospital ambulance settings?
The O2 Max runs off an oxygen cylinder and is a disposable system that comes complete in a packet. And that's really great because it means that you can take it to the patient's bedside. And they have severe respiratory distress, and it means that you can just set it up at the bedside, stabilise them, and then move them to the vehicle or to the area that you want to move them to, rather than actually having to move the patient to the equipment in that acute phase of respiratory failure. It makes a huge difference. Remember when using CPAP to always follow your local policies and procedures. I hope I've answered all of your questions. If you want to check out more about the O2 Max, look at our website.